Good evening, Vice Chair Rose and committee. I'm Ann Dunkelberg with the Center for Public Policy Priorities, and we're testifying tonight neutrally on the bill. We believe that the bill is dramatically improved from the final version, and we really appreciate the attention and responsiveness that the senators had to listening to input from a variety of stakeholders, but we have some remaining concerns. So I'll try to quickly go through some of those for you. It's been a long evening, I know. We were very pleased to see the proposal to leave the Department of State Health Services and FPS as separate agencies with a 2023 sunset date. One of the things that occurred to us immediately, along with other old-timers, was that we had seen the Family and Protective Services, or PRS as it was back then, pulled out of then the Department of Human Services over 20 years ago, precisely because it was felt that its function was lost inside a giant agency. So we came to the original filing of the bill with some skepticism about consolidation, reorganizations, offering promise but not being a panacea for the kinds of changes we need. So we were happy to see the slowing down of the process represented in the revised bill and very much appreciate that. We continue to have some concern that I know has also been raised by other commenters about whether we're going to be able to attract and retain the kind of top-notch executives that we need once we're simply offering them division director positions rather than making them agency commissioners. And I guess time will tell the answer to that question as we move into the process that we're looking at right now. Again, we're very happy with the more relaxed timeline, being mindful that some of the negative consequences that we had from the 2003 restructuring, in particular the difficulties that we had with the cancellation of a contract to partially privatize the eligibility system, that much of that was later attributed to having rushed into that process despite some very explicit feedback from the people involved that the system was not ready to go. So it's really important to have timelines be flexible and not let the fact that we imagine we would like something to be done in a short period of time take the place of whether it realistically can actually be done in that period of time. We still have some concern that the transition of the regulatory functions and those really critical major direct service healthcare service programs at Department of State Health Services, that's still slated to happen fairly quickly. And so we do have concerns that that's going to be a very major undertaking for these agencies. And we just share the comment that I know you've heard from many stakeholders that, the balance that we are concerned about is whether there are enough staff resources to devote to a really careful and effective reorganization of those functions and consolidation of new functions, that won't be taking away from really critical things like launching our dual eligibles Medicaid managed care project, the very new addition of nursing home services under the HMO premiums, and the renewal or extension of our 1115 transformation waiver. We have had comments earlier, and we definitely see improvements in the bill about the avenues for input of a geographically diverse citizen stakeholder sort. One of the things that may have been forgotten is that prior to 2003, we actually had governing boards for our agencies and that they were required to have geographic diversity. So we lost a component of that, and we haven't had it for over a decade now. One of the things we're concerned about now with getting rid of a number of governing boards is whether we lose some of the intensity of the expertise that comes from those boards. So essentially, we're going to be collapsing several boards into one, even if we're just looking at DADS, DARS, and HHSC. That one agency council is going to be expected to have expertise on acute care Medicaid, Medicaid managed care, disability and aging issues, rehab, mental health and substance abuse, care for medically fragile children, end-stage renal disease, women's health and family planning, family violence programs, hunger and nutrition programs, and more. Those are just the ones that came off the top of my head as I need to do this. So we have a concern about the capacity of a single council to really adequately do that job, and one of the things that we note about the much improved language is that the latest version of the bill allows the council to add some other members and some geographic diversity, but it doesn't require it. And we would feel more comfortable if that was going to be a component, a required component of the council. I would point out one very quick comment is just that there's a series of public hearings that's referenced before the executive commissioner finalized the transition plan, and it's in my written testimony some suggestions about how that might better be fleshed out to make sure that the public actually has a fleshed out sort of draft proposal to respond to, rather than just coming in blue sky and coming up with ideas about what a transition plan should look like, how that could be more meaningful. And then I'll wrap up just with a reference. We were very happy that the Senate adopted an amendment that calls on the executive commissioner to come up timely with a transition plan for the instituting the stakeholder advisory committees that are enumerated in the bill, and also for crosswalking which of the 32 advisory committees which are sunsetted, which ones will survive, which ones will be consolidated, et cetera, and that there will not be a long time lapse in operation of those. We think that's really important, and I think I want to tie that back to the council comments, because right now, with no longer having governing boards, and then in the future with fewer advisory councils even, increasingly these stakeholder committees are really literally the only public venue for detailed topical policy discussions and meaningful public and stakeholder feedback. So I just want to reiterate how grateful we are that the latest version of the bill is so much stronger on preserving the role of those stakeholder groups. And I would say it's convenient to summarize the sunsetting of those as somehow being that they're all outdated. Well, some of them were just created in 2013, and hard fought, like the reinstitution of having a statewide Medicaid managed care advisory committee. And we're delighted to see that the bill does call for that to be one of several that is supposed to be recreated. But I think it's very important that we don't have any other venue besides those stakeholder committees for a whole lot of public input. So keeping them going is really important to us. There's a couple of other details here, and I'll let them go.
Do you have copies of?
Yes, I have handed out copies of the testimony.
Question, members? Any questions? Thank you.